All right, so in this particular discussion, we are also looking at IMCI, all right? So again, what is critical is to understand what the question wants you to do under IMCI. So these IMCI questions are actually good questions in an exam, in that you can score a lot of points without writing so much. Because once you're done with what the protocol demands, then you're okay, you're good to go. All your marks belong to you. So let's examine the question first of all. I have already highlighted the most important things in this question as regards IMCI. So number one, of course, we have to know the name of the patient. So in this case, it's Jane. Presumably, this is a female because we can see consistency here. You're saying her and all. So this is a female baby. What is the age? Saying 1.2 years. So we have to calculate this in months. Remember again, IMCI has those two parts. Part one is how you assess, classify, and manage a child who is having a child aged between 2 months and 5 years. Then we also have part two, which deals with how to assess, classify, and manage a child who is aged between 0 to 2 months. So as you can see already, this child is older than 2 months because a year is 24. A year is 12 months. Then these are two months. So that is 2 months. So if you add 12 months plus 2, that is coming to 14 months. So this child is aged 14 months. It's just for your own information, because even as you do, for example, breath count, it's important to know the age category of your child. Okay, because there are those cutoff point. We have 60, we have 50 as fast breathing. So now let's look at this child. Of course, we are looking at fever. Here the problem is fever, as you can see. So it's saying Jane, age 1.2 years old, weight 5.2, temperature 40 degrees Celsius. The health worker asked, what is the child's problem? The mother said Jane has sores around the mouth, has been vomiting everything after breastfeeding. Okay, so you have to pay particular attention to what the mother is saying. Now, remember to say, whatever the caregiver says, you take it word for word. So you write it in direct reported speech, even when you're discussing your question. The mother says, Jane has sores around the mouth, has been vomiting everything, and has been vomiting everything after breastfeeding. So you don't have to change the words here. Just write the way the caregiver has been saying it. Then goes on further to say this is the 3rd time she has been seen by a health worker. So this is no longer an initial visit. This is a follow-up visit. Okay. Then finally, the question is asking us to assess, classify, and identify treatment. Okay. Or since it's an exam, they will say and manage. You see, they will change the language now. Assess, classify, and manage. But in IMCI, we call it treatment. Now, when they say manage, remember, you have to write your nursing management after that. Okay. Of course, with reference to IMCI. Now, let's go back to the IMCI booklet. How do you assess a child with fever? Okay. There are other problems around, like sores in the mouth, vomiting everything. All those are things to consider. Now, this is different from the earlier problem we discussed, where it says the child has fever, or where the child has diarrhea. Okay. Here, the problem is hidden in the question. It's fever. That is the problem here. Okay. Sores in the mouth, you saw that this is pointing to it's pointing to chicken pox. It's pointing to measles, sorry. So it's pointing to measles. So at the end of the day, what they're expecting you is to come up with a specific classification for this child. They don't want you to run through the whole assessment of a child who has fever. They want you to arrive at a particular classification. Is it a pink? Is it a yellow? Is it a green? With the appropriate classification. So let's go to the booklet and see how to assess a child who has fever. Okay. Let me go to fever. Here, problem. Okay, this is a child with fever. All right. Now, okay. So we have, so a child has fever here, temperature 37.5 or above. So first of all, like we are saying, you get the name, you get the vital signs. Is it initial or follow-up visit? Then finally, you do your danger signs. Then you come to this part now. Under fever, it can be fever by history. It can be fever by feel, like you feel the baby feels hot, or fever by temperature or thermometer reading. So that one, we're getting fever by thermometer reading. It's already 40 degrees Celsius. And remember that before you even continue assessment, if the child has fever that is 38 degrees and above, immediately you must give an antipyretic. You give a shot or a start dose of Panadol. Okay, that is very critical. Before you even continue the assessment, just give paracetamol as a start dose. Then you can continue with your assessment. So here, there's no need to ask if a child has fever. You already have been given, say the child has 40 degrees Celsius. Now, next thing is decide whether the child lives in a high or low malaria risk area. Okay. This is Southern Africa. And we know that malaria is endemic to this place. So there's no need to ask this. You should there and then, do a malaria test. Okay. That is if there is no severe classification. Okay. So if it's a high malaria, like you're saying, if in all fever cases, if high malaria test, do a malaria test. Now, usually these tests come negative, okay? But what is important, you're writing this theoretically. So you're going to do a malaria test. Again, what you're going to do there is to assume, okay? If the malaria test comes out negative, if the malaria test comes out positive, what do you do? If it's negative, it's then malaria. What is causing the fever? It is, if it's negative, then malaria is not there. There could be other problems causing the fever. Okay, but this is a high malaria endemic region, Southern Africa. So you ask now, for how long does this child has been having fever? Again, here the cutoff point is 7 days. Is it 7 or more, or 7 days and less? If the mother says, yeah, I think it's 7 days, you have to ask if the fever has been present every day. Okay, not 2 days there's fever, 2 days there's no fever, then fever starts again. We don't consider that as 7 days of fever. Okay. Then has a child had measles in the last 3 months? This is an important question because it could be that it's a measles that is causing this. Okay. The child is still suffering from the symptoms of measles. Okay. So that's why we ask if they had measles in the last 6 months. So you're doing this under assessment. Thereafter, you look now for complications. Okay. Complications of fever. Stiff neck, runny nose, or any local bacterial infection. Things like pus draining from the ear, pus draining from the eyes, any signs of local bacterial infection. Okay. Then after that, you look for signs of measles, rash. So you have to do a physical examination. Check if there's any cough, if there's any runny nose or red eyes. Okay. Now here we are told, say this child has some mouth complications. Okay. Now, if you go back to the question, let me screen it for you again. So let's go back to the question so that we don't go out of topic. Okay, so you're saying the child has been vomiting everything after breastfeeding. This is a very critical part that you must not ignore in your assessment. So as you are writing, it should come out to say, this child, of course, has been vomiting everything when the mother tries to breastfeed, and that is considered as a general danger sign. So already says any general danger sign or stiff neck, then you classify this child as having very severe febrile disease. So when you're done with all your writing, your classification of this child, Jen, should be under the pink row. Very severe disease. So there's no need to explain these other parts of malaria, fever, no malaria. Why? Because they are not important now. You've already known what is the diagnosis of this child. So you go on to address the problem that the child has. Okay, here it says you have to give artesunate or quinine in severe malaria, first dose of appropriate antibiotic, prevent low blood sugar, you're preventing hypoglycemia, and give a first dose of paracetamol. I mentioned this, like, as long as temperature is 38.5 degrees and above, you have to give Panadol before you even continue with your assessment. So you see the difference in the two questions. This one, they've given us enough information to come up with a specific classification. So they don't want you to explain all the three rows, the pink one, the yellow one, and the green one. There's no need for that. You just use what the information has been given, show the steps you use when assessing, ask the number of days, do malaria test, check for signs of measles, check for signs of general danger signs, check for general danger signs. Then after, you go on to assess, to classify. And then we're saying, according to IMCI, we'll classify this child as having very severe febrile disease. Thereafter, the question may say now, treat the baby, okay? In that treatment, what they're asking you to do now is to do your nursing management, aims, the physical exam, the investigations, the history, then you go on to manage the child as such. Otherwise, this is what I had for you, and I didn't intend to have longer discussion because you guys are in a critical phase of your training where too much information is dangerous. So we end it here. For any queries, I think you can still reach out to me. We explain further.